Hello, thank you for the opportunity to present our initiative, the Primary Care Dialogues podcast. We are an interdisciplinary team of young health professionals from Greece. The Primary Care Dialogues podcast is the first Greek science communication podcast that discusses issues relating to primary healthcare in Greece. Our vision is to advance and promote primary healthcare's fundamental role in healthcare provision and make healthcare more people-centered, accessible, and sustainable. Our podcast is primary healthcare centered and public health oriented. We talk about current issues that concern primary healthcare. We analyze the social aspects of health issues and the health aspects of social issues, and we discuss clinical aspects of prevention, diagnosis, and treatment of common diseases in primary healthcare. It is important to say that we try to approach all the topics through the lens of the biopsychosocial model of health, and we try to discuss both clinical implications and epidemiological data of the issues, but also we put great emphasis on the social determinant of health inequalities, sustainability aspects, and the current affairs. We do this by hosting discussions with health professionals at various stages of their careers, interviews with experts, and we also talk about issues that concern us. Our primary target groups is the primary healthcare professionals, but of course, everyone interested in the topics can listen to our episodes. As we said, we are an interdisciplinary team of health professionals in Greece. We are resident doctors in general practice and family medicine, in cardiology, in pediatrics, in general surgery. And also, we are master students in primary healthcare, public health, and health policy and health services management. Our team is supervised by a professor of primary healthcare and medical education. So let's dive into our episodes. So far, we've published 9 episodes. When the abstract, when the abstract was submitted, 4 episodes had been released. Since then, and at the time the video presentation is recorded, 4 more episodes have been released, and by the time of the conference, we have also released the 9th episode. Moreover, we have 3 more episodes that have been recorded and are in post-production phase, and there are 5 more episodes in production, and of course there are many more ideas under development. So let's explore our episodes. The first one was an introductory one where we introduced the podcast and the team. The second one focused on the specialty of general practice and family medicine, and we decided to talk about this topic since Greece is a country that has a great amount of doctors per 100,000 people among the European countries. It tops first. But when it comes to the number of general practitioners per 100,000 people among the European countries, Greece is ranked at the bottom of the list. The third episode focused on the seasonal flu and flu vaccination. This episode is part of a greater initiative that took place during the months of October to December 2023. And we discussed both epidemiological data, but also clinical implications of the seasonal flu and the flu vaccination. In the fourth episode, we focused on the accessibility of disabled people to health services. In this episode, we discussed the social perception of disability, which focuses on the barriers faced by disabled people rather than their physical impairments. So the social perception of disability considers that the activities of the people are not limited because of their impairment per se, but because of the barriers caused by the lack of social organization and support. In the fifth episode, we had the opportunity to discuss with a young GP trainee who had the opportunity to travel to Bolivia to practice as part of his residency training for 3 months. The sixth episode focused on the climate crisis and planetary health, and we decided to discuss about these topics because it was the time of COP28 and also the new publication of the last Commission report on climate change and health. So we discussed the triple planetary health phase and also our role as health professionals. Our seventh episode focused on breast cancer because, according to data, breast cancer is the most common cancer among women in Greece, in the Europe, but also worldwide. And we had a very engaging discussion with a representative from Alma Zois. Alma Zois is a non-profit organization which was founded by women who had experienced breast cancer. All right, episodes focus on the modern perspectives on the pharmacological management of type 2 diabetes mellitus, and we discuss the latest developments in its pharmacological treatment, the importance of dietary measures and preventive examinations, and of course the role of primary healthcare in the prevention and treatment of the disease. And finally, our last episode, the ninth one, focuses on a kindly different topic, the cinematic arts and the use of narrative medicine in education. And we have a discussion with an expert on cinema education. The episodes are to be released soon, focus on obesity, on the happiness, and how we can promote the subjective well-being of the people, but also our well-being as health professionals and in osteoporosis. But we have many more ideas under development, and here you can see some of the topics that we are discussing, which are gender-based violence, cancer screening, LGBTQ plus people and their mental health or their access to healthcare, alcohol and health, primary healthcare, and the ATA declaration, among many other ideas. So, a unique characteristic of our podcast is our commitment to the principles of diversity, equity, and inclusion. And we have actually put much focus, much emphasis on those principles. So, what do we do to achieve the diversity, equity, and inclusion as part of our research? An important part of our practices is that we provide all the episodes in transcripts. So far, all our episodes are transcribed into Greek, but we are also working on to translating them into English to be more accessible to a more diverse group of people. Another practice that we use is that we try our invited speakers to come from different disciplines, both health and non-health, and also levels of experience. And here you can see some of the examples. So in episode 3, in which we discussed seasonal flu and flu vaccination, we had an epidemiologist and postdoctoral researcher and a member of the National Vaccination Committee. Whereas on episode 4, which focused on the accessibility of disabled people to health services, we had a trainer on mobility, orientation, and daily skills for the visually impaired people, and also civil engineering, someone out of the health sphere who specializes in accessibility. Another practice that we use is that we try to use inclusive and gender neutral language whenever possible, since the Greek language is a gendered one. And also we try to use a variety of examples and diverse people representations, mainly in our graphics, but also in the examples that we discuss during our episodes. And here you can see some examples. So we use people from diverse backgrounds and also from different ages and genders. Some other practices that we use is that all the colors that have been selected for our podcast brand identity are colorblind friendly colors. Also, we try to list all the graphic text separately when we post something in our social media so they can be easily recognized by reading apps for blind and visually impaired people. Last but not least, we're open to all this feedback, and the feedback can be provided across all the podcast platforms, both verbally and written, but also nominally and anonymously. Another important part of our commitment to diversity, equity, and inclusion is that we try to distribute our episodes across the podcast platforms, Spotify and Google Podcasts, for social media, popular with different age groups. We mainly use Instagram, Facebook, and LinkedIn, while we are now trying to also develop our TikTok account. And also all our episodes are available via our website, both in Greek and in English. Let's see some more insights about our reads and analytics. So far we have 500 plus plays across Spotify and Google Podcasts. The most popular episode is the one on the specialty of general practice and family medicine, whereas the episodes with the best audience retention are the climate crisis and planetary health and the breast cancer, our discussion with the organization, Almost Race. When it comes to audience, of course, as it is obvious, the majority of the audience comes from Greece, but we also have people listening us from the United States, Bulgaria, United Kingdom, and some other people from other European countries, but also from Morocco. And when we see the people that listen to our podcast in Greece, we see that the majority of them come from Central Macedonia, which is also the region where we are based, but we also have people listening to our podcast from across every region of Greece. As for the age group, our podcast is listened by people from 18 plus, and we see that there are two peaks in the 23 to 27 age group and also the 45 to 59 age group. Our Instagram account counts 96 followers and it's fast growing, whereas our LinkedIn profile has 100 plus followers and our Facebook group has more than 400 members. Some challenges that arise concern the balancing of our time between work, studies, and keeping the podcast active, keeping the flow of episodes and our social media presence at the current rate. Also, we have many ideas, so another challenge is to try to make all our ideas for future episodes a reality, which involves spending a lot of time, resources, and outreaching for guest speakers in all the phases of the production of the episodes. And also, another challenge is grow our team and also to build a stronger relationship among all the team members. And when it comes to the future, we are very motivated to continue and improve our project and publish more episodes and talk about diverse and many different issues. Another future idea is to try to align the episodes to our viewers and also our team interests. And of course, we continuously aim to increase the outreach and to disseminate the podcast to a greater audience. Here you can see our social media and how you can find us in Spotify and Google Podcast and listen to our episodes. And also you can follow us in Instagram, LinkedIn, TikTok, and be part of our community in Facebook. And if you want to know more information about our podcast, you can visit our website. It's also available in English. And if you have any inquiries, feel free to text us via email. Thank you very much.